We begin tonight talking about your health. Joining us is Dr. Nirav Shah. He's a pulmonary and critical care physician at the University of Maryland Medical Center and a professor of medicine at the University of Maryland School of Medicine. Doctor, thank you for joining us.
Thank you for having me.
We're heading into that season where families and friends get together, having a good time, maybe spreading some germs, and all that is about to pick up. Have we seen any signs of that yet?
We've definitely seen signs of different viral infections causing hospitalizations. Lately, it's been more COVID-19, but we're going into the season where we're going to see a lot of influenza, RSV. We'll see pneumonia kind of pop up as well, and it's a good thing to talk about at this time of year.
Makes me long for the hot days of summer. If you were going to design a model to spread RSV, COVID, the common cold, and all that, you couldn't do better than to have the holiday season where people travel, they get into airplanes, other modes of transit, and then they're in enclosed spaces, get together, and then a few weeks later do it all again. Is that why it happens this time of year?
It depends on the different viruses that you're talking about. Some of them have a seasonality to them. So influenza, for sure, we see the seasonality kind of coming around this time of year. And so this is why the big campaign to get your flu vaccine at around now, maybe a little bit earlier than now, is a good idea. But I think that some infections, there isn't a seasonality to it. So getting protected kind of early on and doing the common sense things to protect yourself and others is a good idea.
In terms of people protecting themselves against COVID, do you think there's a bit of COVID fatigue after all this time? People mostly have had COVID. They've had a bunch of vaccines. I think I've had 5 at this point. Are we at risk of not taking it seriously enough?
I think that's definitely true. I mean, I think if you think about the general population, you would say, well, I've already had it. It wasn't that bad, right? And I think the idea is that we, just like the influenza, a lot of us have had flu in our lifetime and we've done fine, but there are times when you have comorbidities that are other illnesses that you have or other risk factors that you have that might make you more predisposed to getting sicker. And so we've seen patients get admitted with influenza, we've seen patients get admitted with COVID-19, and we continue to see those admissions, right? And so I think that while there is fatigue, I think that protecting ourselves is always a good strategy, and the best way to protect ourselves is to really think about vaccination in the right population, and if you're at risk or at high risk, and talk to your healthcare provider, because I think that a lot of this is about having that conversation about, what are my medical conditions, what's going on in my life, what am I doing, and how can I best protect myself?
So certain people, depending where you are in life, might need different vaccines, might need it earlier, might need a stronger dose. Isn't there a stronger version of the flu shot for older folks?
There is, definitely, because we know that age as well as other medical conditions can increase the risk of getting hospitalized with influenza and potentially having a worse course, right? So some patients will get influenza and they'll fly through it. They'll feel bad for a few days and then recover. But then some patients end up getting hospitalized. They might even get a super infection after influenza or pneumonia that can cause a lot of issues in the hospital setting as well.
What would you say to someone who thinks, I know there's a flu shot, but I also know that there's Tamiflu, an antiviral to treat the flu, and if I come down with it, I'm just going to get the pills.
Yeah, I would say that I think it's better to avoid getting the flu to begin with, or at least getting a less severe case of it. A lot of people will say, I got the flu vaccine, but then I got the flu anyway, right? And the reality is that's true for COVID as well, but in both of those situations, the severity of the illness is much less if you are already protected a little bit with a vaccination. So I think it's important to say, yes, we do have treatments that can shorten the illness course or at least dampen the symptoms a little bit, but preventing it or trying to prevent it from the get-go is probably the better option.
I don't know if there's data on this, but the idea, to be honest, I don't get the flu shot every year. I get it most years. So at this point, I've had dozens of flu shots. Is there any cumulative benefit or it just wears off?
Yeah, so there unfortunately is not a cumulative benefit, right?
Darn.
And so the reality with flu is that it's constantly changing. The genetic material of the influenza virus is changing. And so that's why there's a different flu vaccine every year. And we don't really actually know how good this flu vaccine will be until after the flu season, when we can measure that, right? But other things like the pneumonia vaccine, for sure, you get the pneumonia vaccine once, and because that's a bacteria that you're getting protected against, the genetic variability is not as much as a virus like the flu, or even COVID for that matter. As you mentioned, COVID vaccines, we've had multiple ones that have been out there that have protected against kind of different strains or variants. I think that COVID itself increased the ability for all of us to understand vaccines and also viruses a little bit more than we did before.
With the flu shot in particular, you've always heard from people who got the shot, 2 days later got sick, maybe with the flu, and believe they got it from the shot. Do you see that in your practice? And how can you disprove that that's what happened?
Yeah, so the flu vaccine is not actually giving you the flu, right? So it's not a live vaccine where you can get the flu from the vaccine itself. So what we usually say is that you probably were already exposed, and it takes about 2 weeks after you get the flu vaccine to really build up the immune system, the antibodies that are going to be able to fight that. So we often recommend that really by the end of October that you get the flu vaccine going into the holiday season, right? So there's a huge campaign out there about, flu with boo or boo with flu, so Halloween, kind of that idea.
Okay.
So we do recommend that you get it kind of in advance so that you can build up that immunity.
Reminder viewers, if you have a question about respiratory virus season or any of these vaccines, send us an email to livequestions@mpt.org. Are all of these things spread in a similar fashion through, droplets, aerosols in the air, personal contact?
Yeah, so the viruses for sure, right? I mean, surfaces that we touch, people that we're interacting with, as you mentioned, kind of the tight quarters of airplanes and being in line to get on the flight itself and really waiting on the tarmac, et cetera. Being in close family situations where you have a lot of relatives that are coming from all over the place and bringing their germs and their good wishes with you, with them, right? So I think the idea is that you want to practice good hand hygiene. Really, if you do have viral symptoms like a cough, sneezing, et cetera, I think that we just like you said about vaccine fatigue, I think that there's mask fatigue as well, but I think that's a great way to protect others and protect yourself, that if you have symptoms, putting a mask on makes a lot of sense.
RSV is the one of these about which I know the least. Who should get vaccinated for that? And how does it differ from the others, including the common cold?
Yeah, so RSV, again, a virus that can cause infection, can cause respiratory symptoms. The reality for RSV is that we say that if you're over the age of 75, you definitely should be vaccinated against RSV. Between ages 50 to 75, if you have comorbidities, I think RSV is a very good vaccine to get for patients. And so we're thinking about things like diabetes, pregnancy, patients with underlying immune suppressed conditions. We see a lot of patients that have medicines that cause their immune systems to be suppressed. So RSV is a good option. Again, I'm an adult doctor, so I won't speak to the pediatric world, but RSV is a common one that you see in kids as well. And so vaccinating your children as well might be a good thing to talk to your pediatrician about.
Viewer question. Viewer wants to know, should I wear a mask to stop transmitting respiratory viruses or wear one to keep from contracting one? And I think I know the answer to that.
You can do both.
Right.
You can do both. I think that if you have symptoms, for sure, wearing a mask can protect others around you. If you're trying to protect yourself, then having a mask, it's not foolproof, but it definitely will reduce the amount of inhalation of particles that could cause infection.
Let's talk about over-the-counter meds. I mean, if somebody comes down with something and it's not serious, it feels like the common cold, maybe it is the common cold, what works to get through those tough couple of days?
I think if it's a viral infection, I think a lot of hydration, staying hydrated, kind of keeping up with your diet and kind of things like that. If you have symptoms, obviously you can use some of the over-the-counter medications to try and control some of the symptoms, but really, quite honestly, not they're not that effective. A lot of people take them, but I think if you're having body aches and things like that, taking some medicines to help with that, if you're getting something over the counter, like Theraflu or something like that, it'll have a bunch of ingredients in it. So you want to be careful a little bit about what you're taking, but I think that they can control some of the symptoms, or at least attenuate some of the symptoms.
Now, how about if it's worse than that, and it gets bad, and the trend is bad, and how do you know when it's time to get help, and how do you know whether it's a trip to urgent care versus your emergency department?
Yeah, those are good questions. I think that in terms of the severity, if you're having shortness of breath, if you feel like you're not catching your breath, if you feel like your chest is tight and you're having difficulty breathing, those are all times where you need to really get seen by a professional. In terms of urgent care versus going to an emergency room, I think that the reality is that urgent care might be faster, and they might be able to test you pretty quickly and kind of get you what you need from a medication perspective. In terms of the emergency department, if your oxygen level is low, if you have comorbidities that you know are going to predispose you, like immunosuppressive medications and things like that, I think going to an emergency department where they might have more facilities to test for different things could be a good option.
And if somebody's in that situation, pre-existing condition, should they have the fingertip pulse ox thing?
Almost all of my patients do. So I'm a pulmonologist, and I see a lot of patients with COPD, asthma, a lot of patients that have had a lung transplant, for example, and all of them carry their pulse oximeter with them. Now, if you have one at home, I think a lot of people do from COVID. I think that it's good to put it on your finger and see what it says. But I would rely on how you feel. If you're feeling terrible and you really feel like you're not catching your breath, that's the time to get checked out.
Dr. Nirav Shah with University of Maryland Medical Center. Doctor, happy holidays. Thanks for stopping by.
Thank you so much. It was a pleasure to be here.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.